Once you are enrolled in Part A and Part B, you are then allowed to enroll in private coverage from a private insurance company to complete coverage because, again, Part A and Part B alone are not enough coverage. So there are two options. The first is keep original Medicare, that's Part A and Part B, with the government as the insurer of that. Add a Medigap or Medicare supplement plan. Again, Medigap and Medicare supplement means the same thing, just different terms. And add a Part D plan to that. So it's three components: the government portion, the private insurance portion with Medigap or a Medicare supplement plan, and a private Part D plan. So with this, you gain ultimate flexibility in where you get medical care. No networks. You can go anywhere in the country as long as the provider accepts Medicare, which is 98-99% of all healthcare providers. There are no prior authorizations to deal with, no referral requirements. If they're accepting new patients, with Medicare, then you can go and it will be covered as long as it's a covered service. This is, as you can imagine, the more expensive of the two options. The base rate is $300 to $350. If your income is high, and the calculator within this guide will show you that, what the ballpark is, it's going to be higher than that. But for most people, $300 to $350 a month. The annual out-of-pocket maximum for medical expenses is laughably low. It's just the Part B deductible, which for this year, 2025, is $257. That goes up 3-5% a year, but even 10 years down the line with those increases, that's relatively nothing. There are going to be little to no surprises with this. This is great for people who travel a lot in retirement, or people who are snowbirds, live half the year somewhere, half the year somewhere in a completely different part of the country. You don't have to check and do research to make sure is my doctor in network or not. As long as they accept Medicare, and you should figure that out, and you should already know that, then you're good to go. You will need to buy Part D coverage on a standalone basis, and you'll need to review that every year. That's a best practice. But as far as original Medicare and the Medicare supplement go, it's pretty much a set and forget thing. You don't need to renew it every year. That's not going to change from year to year. You want to check every 2, 3, 4 years on pricing to see if maybe there's a more competitive rate. If you're healthy enough to qualify, you just jump to that Medicare supplement, but not necessary. You can buy a Medigap plan, no questions asked, when you first join Medicare for the first 6 months. But anytime after that, then you need to go through medical underwriting, which it's just a series of health questions, but better safe than sorry. If you're at all interested in a Medicare supplement plan and going this route, I recommend starting with it. And if at some point you realize, I don't want to keep paying this extra amount for this, I don't use it, or I'm not happy with it, then you can go to Medicare Advantage. As long as you understand what the trade-offs are, you'll be okay. But I have yet to have a client who wants to move from this to Advantage, but not to say that doesn't happen. Another thing to point out here, not a huge deal, but dental and vision coverage for the routine maintenance stuff like exams and cleanings, frames, lenses, not covered under this. You can buy a standalone dental and vision plan if you want. Sometimes it makes sense, sometimes it doesn't. As far as which Medicare supplement or Medigap plan to choose, let me touch on that a little bit. This is another set of letters, which may be confusing at first, but I'll eliminate most of the confusion here. So this link here, Medicare supplement plan types, will take you to a page on Medicare.gov that explains this. It's got this chart. You've probably seen this if you've researched this at all online. These are all the types of Medicare supplement plans, plans A through N. It skips, a couple letters, but essentially you need to look at Plan G and Plan N. Plan F was popular, but as of 5 years ago, they stopped selling it to people who are new to Medicare. So Plan G is the most comprehensive you can get. Plan N is the next most comprehensive you can get. Plan G is the most popular now. Plan N is the second most popular. With Plan G, it's going to cover everything that you would be on the hook for with original Medicare, with the exception of the Medicare Part B deductible, which again, this year is $257. Not a big deal at all. So, ultimate peace of mind, ultimate knowledge of, hey, I know what my monthly cost is for the plan. And then when I go to get medical services, I'm going to pay next to nothing. Plan N, you might entertain this if you're a little bit more value driven. Plan N, depending on your zip code, your age, your gender, is going to be about 15-20% less expensive, sometimes a little more. There are two trade-offs that Plan N doesn't cover that Plan G does. The first is it's going to introduce a copay. So you're going to have up to a $20 copay for an office visit, for it's a regular doctor's office or specialist visit. And you're going to have up to a $50 copay for an emergency room visit that does not result in an inpatient hospital admission. So just an in and out of the ER. Not a big deal, especially with how expensive an ER visit is otherwise. So Plan N doesn't cover that or introduces those copays. The other thing Plan N doesn't cover is something called Medicare Part B excess charges. Plan G covers them, Plan N does not. Very simply, what an excess charge is, let's say your doctor accepts Medicare, but for a specific service or treatment, what have you, they don't accept Medicare's rate for that. So like what Medicare would pay them to give you whatever the service is. They say, you know what, I need a little bit more money than that. They can charge up to 15% above that Medicare rate. And if you had Plan N, you would then be on the hook for that 15%. Just very simply put. It doesn't happen very often. I believe it's 2 to 5% of all Part B claims have excess charges attached to them, so it doesn't happen often. And from what I understand and what I've heard in my professional circle, it is mostly dermatologists and psychiatrists who will assign an excess charge. So take that information for what you will. If you're okay with that, Plan N is a fine choice. If you're not okay with that, if you have any hesitance at all, and you just say, I'm opting for the Medicare supplement route, I want the best, let me just not worry about it, then go with Plan G. Either is a fine and sound choice, just as long as you know the difference. And Plan N, the other thing I might say is an argument for it, while it's also cheaper than Plan G, the rate increases, at least the idea is the rate increases, which you can't avoid with any of this, are going to be less dramatic. The rates are going to be steadier because if you think about it, it adds a couple of speed bumps via those excess charges and the copays from people just, saying, just throw the book at me. I don't care what it costs because it's covered, right? So, well, that's more expensive to insure. So if you give people a little bit more incentive to be an informed and smart consumer of medical services, then the insurance is going to be less expensive, right? That's the whole idea. So Plan N reflects that. Now, not to say that is a hard and fast rule. That's how it's always going to be, but that's the general idea. And you see that reflected in the prices between G and N, which you can check anyway. So that's how to choose between Plan G and Plan N. Those are the types of Medicare supplement plans that I recommend choosing from. There are also high deductible plans. High deductible G is going to be the one that's marketed the most, the one that's most available. Works much the same, but it's going to have a high deductible, which is around the $2,500 mark, and it's going to be less expensive than both Plan G and Plan N. Not as popular. Most people go with Plan G, and Plan N would be next up. How to choose a Part D plan if you're going this way, because you're going to need to decide that as well. Basically, all you have to do is use a tool like Medicare's Plan Finder, which I have a link to in this guide, and you enter your drugs, your dosages, your preferred pharmacies or pharmacy, and then you'll see with every plan on the market which is going to give you the lowest total cost for your drugs. That's the whole point of the plan, is make my drugs affordable, right? So whichever plan gives you the lowest total cost at your pharmacies for your drugs, that's the Part D plan to go with. So option 2 is Medicare Advantage, also known as Part C, but mostly known as Medicare Advantage. To reiterate, this is technically, if you go with a Medicare Advantage plan, you can't get a supplement. It's one or the other, and you're in most cases going to want to get a plan with Part D drug benefits included. So the way this works, if you choose this, you are trading in original Medicare, that Part A and Part B that the government insures. You're trading that in for an entirely private plan. So Medicare Advantage plans, as far as the services covered, are required to cover at least what Part A and Part B do. Doesn't mean they pay for it as well as Part A and Part B do, but they at least need to include it on the schedule of covered services, if that makes sense. So it includes that. Like I said, you're probably going to want to go with a plan that includes Part D benefits, so you don't shop a separate plan. You have to, if you're going to get Part D coverage, it has to be included with a Medicare Advantage plan. You can't mix and match. And a Medicare Advantage plan is most likely going to include some extra benefits like dental and vision coverage, sometimes hearing coverage, over-the-counter benefits like, $25-50 every couple of months for Band-Aids and aspirin and just other stuff at the drugstore, health-related items at the drugstore. And a lot of people are enticed by that, but I strongly encourage everyone to remember the point of all this, which is the medical benefits and the drug benefits. That is the most important thing when you're comparing Medicare Advantage plans, when you're comparing Medicare Advantage to Medicare supplements. Don't get distracted by the freebies. They're nice to have, great, but when it counts, you're not going to care about that. So the cost of this, it's about half the cost of the Medicare supplement route. Again, if your income is on the high side, your baseline price goes up, but the main reason people go with Medicare Advantage is the low monthly cost. Some people will say, oh, it's nice to have all-in-one coverage and that's more convenient. It's not. That's kind of a sham. It's the cost for the plan itself. The trade-off, higher out-of-pocket costs. This year, the maximum allowable cap on your exposure is $93.50. Not all plans are that high, but it's inching towards $10,000 or so. So if you have a hospitalization or a diagnosis of a serious illness or something else expensive, then you're going to be on the hook for that amount. There are ways to bridge that gap, like I talked about in the overview, but just know that that's how a Medicare Advantage plan works. So very important things to consider with this. You have to stay in the plan's network or there's no coverage. The exception would be if your plan is a PPO, there's technically out-of-network coverage, but expect your prices or your share of costs to double at max. So it always makes sense to stay in network, whether you can or cannot. Just prepare to stay in network. That can change throughout the year. It can change on plan anniversary dates, which is January 1st. Your doctor will be in network one year, won't be the next. And that can be really inconvenient and frustrating. There are going to be prior authorizations with some plans. It's a trend that's starting to dwindle a little bit, but just be prepared for prior authorizations. Nobody likes them, but they're necessary in a plan structure like this. Referrals for specialists, that can be a thing as well, so just be prepared for that. So that's Medicare Advantage. The reason to get it is it's a low cost per month. Now, as far as comparing them, I can't technically show you examples of plans to compare because Medicare regulations prevent people like me from giving specific advice or showing exact quotes without your individual consent. But let's just say you can use Medicare's Plan Finder to just poke around and see generally what plans look like from different companies. All the major ones that you've heard of, some that you have not, that are still solid companies, offer these plans. So to wrap this up, go with Medicare, a Medicare supplement with original Medicare and a Part D plan if you want ultimate flexibility, if you can afford those monthly premiums, and you get the value out of it, and it's not the difference between you and buying groceries that month. If that is the case for you and affordability is a consideration, go for a Medicare Advantage plan, and that can be a very fine option. A lot of people are very happy with it. If you live in a large metropolitan area, the networks are going to be large, and you're probably not going to have an issue with that. If you live in a more rural area, then original Medicare with a Medigap plan is going to be worth that extra amount just to avoid the headaches of networks that may be very thin in a less populated area. And again, the last thing here, I've got a link to Medicare's plan comparison tool where you can look at quotes, look at benefits, not anything super in depth, but just get an idea of what your options are without having to enter personal information. You'll just need to put in like, what's my zip code, gender, age, just to make sure pricing is dialed in. All right, so that's the decision on a fundamental basis, and we'll see you in the next video.